I am Dr. Vaishali Naik, consultant endocrinologist at Lilavati Hospital. Today I am going to speak to you about thyroid disorders and its special information on women. Thyroid gland is a small butterfly shaped gland which is there in the front part of our neck. It secretes the T3, T4 hormones, and these hormones are required for the cellular function of every organ of our body. The thyroid gland can secrete proper amount of thyroid hormones only if we have adequate iodine in the body. Hence, we should take iodized salt regularly. The thyroid gland is regulated by the hypothalamus and the pituitary. The pituitary secretes the TSH, which regulates the T3 and the T4 hormones. Thyroid gland disorders are mainly of three types. One is hypothyroidism, in which the thyroid hormones are secreted in less amounts. Hypothyroidism, in which the thyroid hormones are excessively secreted. And third type is swelling of the thyroid, in which the patient can have a nodular or a multinodular goiter. Women are more prone to having thyroid disorders because the most common cause of thyroid disorders after iodine deficiency is autoimmune thyroid disease. So how do we know whether a person has thyroid dysfunction or no? For that, we tell the patient to do hormonal tests called as T3, T4 or free T3, free T4 and TSH. Along with this, depending upon the symptoms and the signs that each individual patient has, we ask them to do a scan of the thyroid or a sonography of the thyroid and sometimes even the needle aspiration cytology to decide whether the thyroid gland needs to be removed. Women in particularly are more prone to thyroid disorders. So they can suffer from thyroid disorders at any point of time in their life. Hypothyroidism, the commonest symptoms seen in this are lethargy, weight gain, dryness of skin, hair loss, constipation. Hypothyroidism, common symptoms are weight loss, palpitations, tremors, loose motions. These are commonly seen at any point of time in the lifespan of the woman. However, particularly age-dependent symptoms also help us to find out if the woman or the child has a thyroid problem. Example, in childhood and adolescence, the girl child may have delayed puberty or precocious puberty or growth disorders, or the adolescent girl can have irregular periods. The woman in reproductive age group can have irregular periods or multiple pregnancy losses or can have infertility. Also, patients or women especially who are elderly, they may not have any symptoms and come to know that they have thyroid problems only on doing a routine check of their TSH. What is important that every woman should know is despite having a thyroid disease, they can have normal pregnancies, which is of utmost importance to most of the women. It's important also to remember that somebody who has a thyroid problem should have their thyroid functions normal even before conception, during pregnancy and also postpartum. Sometimes thyroid disorders can present at postpartum state also. What is important is the baby, the fetus, requires thyroid hormones from the women in the first 3 months of their life because their thyroid is developing. But for their development, the mother's thyroid hormones are very important. So it is essential that the maternal thyroid functions are normal. One important message before closing, I would say that every neonatal baby, every child who is born should undergo at least a TSH test in order to find out the thyroid function, whether the parent, the mother or the father has a thyroid dysfunction or no. Thank you.